Do fibroids always cause heavy bleeding?
Not always.
Can fibroids turn into cancer?
Yes.
Does taking birth control pills make fibroids grow faster?
Not always. 80% of women will be diagnosed with a fibroid by the time they're 50. So that is 8 out of 10 women. And women of color, it's actually even higher. It's 90%. One of the things that we do know, there's two links in terms of diet that can help. One is eating a lot of cruciferous vegetables. So cauliflower, broccoli, these kinds of veggies there has been a link to decreasing fibroid size. And the other is vitamin D supplementation. So it really depends on the size and the location. Even if it's 1 centimeter, if it's inside the cavity of the uterus, I would recommend removal. One of the things we look at is the capsule of the fibroid. If it's very clearly defined, so there's a nice capsule around it or a shell around it, we're happy when we see that. Versus if the fibroid looks all irregular and it's not a nice smooth circle, if there are pieces that are pushing into the wall or one with the wall, that raises some suspicion.
Hi everyone, welcome to my channel. I'm your host, Dr. Chhaya Makhija. And today I'm thrilled to introduce our guest, Dr. Cheruba Prabakar, a seasoned gynecologist, menopause specialist, and fellowship-trained minimally invasive surgeon. She's well known as the Fibroid Doc and the founder of Lamorinda Gynecology. It's a boutique practice in the San Francisco Bay Area, and it's my honor to talk to her and learn more about fibroid and understanding fibroids in depth today. I've known Dr. Prabhakar as a colleague, as a physician entrepreneur for almost 2 years. And Dr. Prabhakar, my privilege and honor to introduce you. But if you'd like to add on anything else about yourself, and also describe what does a minimally invasive surgeon do, we can learn more for you about fibroids later on.
Yes, thank you so much, Dr. Makhija. It's my pleasure to be here. So, minimally invasive surgery is surgery that's done with a few small incisions or holes in the abdomen versus a big cut. So, if you think about a C-section or any other, when we think about surgery, often we think about a big incision in the hospital for a few days. And that's sort of, a thing of the past in many fields, but especially in gynecology, we've moved on to doing most of our surgeries, even very complex surgeries with a few tiny holes. And so that's what a minimally invasive surgeon does. And I take care of a lot of fibroids through that approach.
Very, very cool. So quick healing, right? And does that include robotic surgery in minimally invasive surgery?
Yes. So it includes a laparoscopy, which is a two-dimensional approach with a few small incisions. Robotic surgery is three-dimensional, which is very, very exciting. And the visual optics are just so much better. And you also have very good wrist movement for more complex things like suturing in the body. And so, yes, minimally invasive includes both of those as well as vaginal surgery. A lot of people don't think about that, but vaginal surgery is the least minimally invasive because you have no holes at all if you're taking out a fibroid or a uterus through that approach. So these are the different ways we do minimally invasive surgery.
That's impressive. So just a new era of, surgical techniques that you're sharing with us.
Yes, and it's really great because our patients go home the same day. The blood loss is minimal. They're often not even taking any narcotic medications. A lot of patients just take Tylenol and Motrin, and that's all they need. The return to work is a lot faster, which is a big deal for many patients, or even taking care of their kids and other responsibilities at home. They can just get back to all of those things a lot faster.
How very impressive. Thank you so much. So what we're going to start with is a rapid fire round, which will have 5 questions. And if you can give us the answers as yes, no, it depends, or a one-liner. And then we dive into the details or the nuances of fibroids. So your first question is, do fibroids always cause heavy bleeding?
Not always.
Can fibroids turn into cancer?
Yes.
Does taking birth control pills make fibroids grow faster?
Not always.
Will fibroids automatically shrink after menopause?
Yes.
Can eating certain foods alone prevent fibroids?
Me.
Okay, so we had very clear answers for many of them, but it depends, or maybe in a couple of them. So our first question would be, when we're talking about fibroids, our audience, and I'm sure many of our patients would like to know what are the different types of fibroids and what's the reason? Like, why do they appear in women?
Yeah, that is the $1,000,000 question. I wish we knew why women got fibroids or developed fibroids. Fibroids are really common and they are tumors or balls of smooth muscle that grow in the uterus. And they can either grow inside the uterus, they can grow on the wall of the uterus, or they can grow even on the surface of the uterus. And 80% of women will be diagnosed with a fibroid by the time they're 50. So that is 8 out of 10 women. And women of color, it's actually even higher. It's 90%. So if you think about that, 8 to 9 out of 10 women will have a fibroid by the time they're 50. That's a pretty significant statistic.
Very
Though they're really, really common. And those are the different types of fibroids, depending on where they are. That's how we classify them. They're called subserosal if they're outside. They're called intramural if they're on the wall. And they're called submucosal if they're inside the cavity. And depending where they are in one of these three locations, that will determine the symptoms.
Are there any known triggers or risk factors?
For fibroids, so genetics is one. Color, so like I said, South Asian, women of color, so South Asian Black women are at an increased risk, family history. And then there's various papers that have shown a link to eating red meat at one link, as well as using chemical hair straighteners. So that is one that's also shown to have a link. We don't have a clear cause and effect, but those are some factors.
Yeah, I'm trying to think this is beyond because we have a whole list of endocrine disruptors in endocrinology, plastics, chemicals, sprays, even our cooking utensils, which have direct impact on the hypothalamus, pituitary, and ovarian axis, and a big cause for infertility where it's unexplored. So, this just brings about more curiosity to what you just mentioned about the link. So, 80 to 90%, that's a very, very large percentage. I didn't have this in my questions, but now I'm curious, is there like a screening test which is recommended or that you would suggest?
Yeah, that's a really good question. There is no screening test right now. What I really think is that a good pelvic exam is the best screening test. Being a gynecologist who's done thousands of these exams, we're usually able to pick up fibroids during the annual exam. In fact, there are many patients to whom I've said, "Hey, you've got a big mass in here. I suspect it's a fibroid." And the patient has no clue. They're like, "What? Like, I have a big mass? And I'm not, these are huge, like 10 to 15 centimeters, and the patient has no idea.
Let me then pause. 10 to 15 seconds.
Yeah, that's like, a grapefruit.
Yes, a
You-
big one, large. It's larger. Yes, very large. Okay.
Very large. And patients often don't know because it's slowly been growing over many years and you just kind of get used to it. You think that you've put on some weight, you think you're bloated, your pants are not fitting. Oh, it's just because I'm getting older, whatever. We tell ourselves all sorts of stories, but it takes somebody to really do a good exam to figure out that, oh, there's something not right here. And a lot of times they may not cause symptoms. So to your question about do fibroids always cause bleeding? Yeah, heavy bleeding, the answer is no, because if this fibroid was not inside the cavity and maybe was kind of growing on the surface, what we call a subserosal fibroid, it's not going to cause bleeding, but it's going to be really big. And an exam will definitely pick it up. I think a lot of women, don't go to a doctor every year and certainly don't go to a gynecologist every year. And so there's no one really doing a good pelvic exam. And so they miss it. And then comes time for fertility or something else. And then it's like, oh, now it comes out and now you actually have to deal with it. So yeah, so a good pelvic exam. And then the next one I would say is a ultrasound, a pelvic ultrasound. Many patients end up getting by the time they're 30 because they had an ovarian cyst or they had something in the pelvis. And so they've done a ultrasound and they can see at that time if there are any fibroids.
So this brings another question which patients ask me frequently. So when I order transabdominal pelvic ultrasound or transpelvic ultrasound, the call from radiology or imaging center would be, oh, can we add the transvaginal ultrasound also? So is it mandatory? And there are certain females who don't feel comfortable with that form of ultrasound. So for fibroids, is there a specific one that you recommend, either or both? What has a highest yield?
Yeah, for fibroids, I always recommend a pelvic, like a transvaginal ultrasound. That is always the best ultrasound. Now, if a patient is very petite, you can probably see the same things via, the abdominal approach. But if your BMI is starting to be a little bit higher, you can't see well through the abdomen. And so in those cases, a pelvic ultrasound is best.
Okay, this was very insightful in your experience. So, we talked about, so they could be asymptomatic even if they're large in size. But what is the most common, or what are some of the most common symptoms that you encounter with your patients? And then we'll talk about the complications with these.
The most common, I would say, is very heavy bleeding, pelvic pain, and then urinary frequency is another one, pain with sex, and sometimes infertility.
Infertility. So, so particularly in younger women, right? They've had all their infertility evaluation. In my scenario, I'll get, an endocrine evaluation done for many other endocrine conditions to rule out the cause. And of course, they might have, pathologic abnormality relevant to their uterus. So, what's your take on, say, if they had uterine fibroids, what is the approach for these patients when you're focusing on treatment to help them increase their chances for fertility?
Yes. So that's a good question. And that's a clinical situation I encounter a lot in the office. So it really depends on the size and the location. Even if it's 1 centimeter, if it's inside the cavity of the uterus, I would recommend removal because that's where a baby would form, for example. And so even if the embryo started to, get into the uterus to implant and it implant for the fibroid, that's most likely going to be a miscarriage. And so, for those who are trying to get pregnant, if you have a submucosal fibroid or a fibroid inside the cavity, then you definitely want to have that removed. If you have a fibroid in the wall of the uterus or on the surface of the uterus, you don't really need to remove it unless it's fairly big. And by big, I mean 4 or 5 centimeters, or it's causing symptoms like heavy bleeding, pain, pelvic pressure, urinary frequency. And so it really depends on the size.
And then their chances for fertility, like, do you see a cause and an effect in these patients who've had all the workup done, nothing else seems to be a cause for their infertility or inability to conceive? The surgery helps them to accomplish their goal?
Yes. So definitely for those who have fibers inside the cavity, surgery definitely helps them get to their goals. But having multiple fibroids, even if they're small in size, half a centimeter, 1 centimeter, having many of these causes an unfavorable environment for pregnancy. Now, sometimes patients will say, oh, but I don't have any pain. I don't have any heavy bleeding. I don't have any discomfort. But then you scan them and you see 10 1 centimeter fibroids. They're all tiny, tiny, tiny. Really tricky thing and a hard thing because sometimes you're telling patients, hey, like, you may have to find a surrogate, because you've got this unfavorable environment. It's kind of like endometriosis, which is a whole different topic.
Marriage.
It's just the presence of them makes it a little unfavorable.
That makes me think, so it's more anatomic. It's nothing to do with, or it may just be with how estrogen and progesterone impact the uterine lining as well. I don't know if they alter that.
Yes. For some people, it is anatomic, but for a lot of other people, it's just the uterine milieu, there's just the environment. Are the inflammatory cytokines or chemicals being excreted from these fibroids that make the sperm and egg not meet? Or if they do meet and come down the fallopian tube and into the uterus, does it make it an inflammatory situation where it does implant? We don't really know, but those are some of the things that I counsel patients on.
How fascinating. What you see on imaging versus what's actually happening internally. Maybe sometimes it cannot be linked. The size doesn't really justify what's going on inside. So, say you have these patients, the ones who need surgical intervention, they are able to, and then they pursue fertility. But what happens to fibroids during the latter half of the woman's, say, reproductive life when there's a transition? So now it's perimenopause, menopause. So what's happening if they have pre-existing fibroids or they did not have any fibroids? So what's happening in that perimenopause, menopause, Ella?
Yeah. So in perimenopause, in general, the uterine lining becomes a little unstable, and many patients can just have irregular bleeding. So that's something that is pretty common. Fibroids at this point are, when we talk about perimenopause being around 44, like even 45, fibroids are rarely growing at this point. However, if the hormones are really out of whack and unbalanced, they could be growing. For some patients in their 40s, they're still growing. And I do recommend, intervention for those patients. But once you reach, 49, 50, 52, which is the average age of menopause, At that point, they don't disappear, but the lack of estrogen actually makes them shrink a little bit. It is a time to be careful though, because if fibroids are actively growing and, getting larger late 40s to 50s, I do worry that there could be some cancerous elements. So it is something to just closely follow with the gynecologist.
So every fibroid which is appearing on imaging, or if it's felt, does it need a biopsy, or would you follow them clinically and with imaging?
I really follow them clinically. What's interesting about fibroids is they cannot be biopsied. There's no way to biopsy a fibroid unless you go, laparoscope. So there's no way to really know if fibroids are cancerous. Sometimes they shed some cancerous cells into the cavity, in which I can biopsy in the office. But a lot of times we only find out about it in, hindsight after we've removed the fibroid and we've sent it to the pathologist, and then we get the news that it's cancer.
So that's one of the very, very common questions that I get when patients had these, small fibroids and they've seen their local gynecologist here and they've just been asked to, follow up in 1 year and then still curious about the biopsy or any form of testing, which gives them 100% reassurance that it's not cancerous. Can you shine some light on specifics? Because as a specialist for you, as well as, with the radiology or the radiology reports that we see, there are certain characteristics to define a benign fibroid or a benign adenoma. So, if you can just share some of the characteristics which differ
Yes.
from benign to suspicious fibroid.
One of the things we look at is the capsule of the fibroid. If it's very clearly defined, so there's a nice capsule around it or a shell around it, we're happy when we see that. Versus if the fibroid looks all irregular and it's not a nice smooth circle, if there are pieces that are pushing into the wall or one with the wall, that raises some suspicion. The second is also the blood vessels, kind of the way the blood vessels appear on imaging. If they seem disorganized or just very, high caliber blood vessels that are feeding this fibroid, that's a little bit more concerning. So an MRI, by the way, is the best test to figure this out. So a lot of patients will go get a CAT scan, but that's actually not the right test. MRI is the best test.
Yeah, see, that's again very, very insightful. The MRI imaging to look at the internal architectural characteristics, right, for uterine fibroids. So, perimenopause, menopause, ideally, your natural process, cycle of fibroids is that they might shrink, they might get smaller in size. So, why are our women still concerned or have doubts about HRT or about hormone therapy when they have these small fibroids? There's a lot of misinformation and myths out there, which I really want you to share. HRT use in these patients where they have benign appearing fibroids on imaging, smaller, don't need surgery, and what's the role of hormone replacement therapy for their menopausal symptoms?
So having small, benign appearing fibroids should absolutely not be a contraindication or should not be a reason why women don't do hormone therapy. Menopause hormone therapy has such small doses of estrogen that this is not going to set off your fibroid growth, especially around perimenopause. So if we think about the amount of estrogen in a birth control pill, let's think about a really big ball. And then if we think about the amount of estrogen in menopause hormone therapy, it's a tiny, tiny ball. Okay, which a lot of people don't even know that. A lot of people think that birth control is oh so tiny, and then now you're in menopause and you're taking this big dose of estrogen. So it's actually vice versa. And so that's something that I'm always educating patients on and saying that we just need to give you a tiny dose of estrogen. So all these years, if you were very comfortable taking oral birth control pills, guess what? Now add a much higher dose of estrogen than what I'm about to give you. So I don't want anyone to feel like, oh no, I shouldn't take hormone therapy because I have these fibroids. If anything, we continue to just monitor them every year with an ultrasound. It's an easy test. It's not very invasive. And we can just provide some reassurance that everything is fine.
Yes, that's, I think the education, the knowledge is it's such a powerful tool. And when patients are seeking, medical expertise, like seeking expertise as yourself, that really takes off or alleviates so much of anxiety and the worry about the word C, which is cancer. So, this was very, very insightful. And I feel like what's being influenced by non-medical professionals versus what's happening with the real patient experiences, real physician experiences definitely outweighs, these insights. So thanks you so much. There is another, very common I won't call it as misinformation, but there's a lot of information out there when people see thinking about that I may have a tumor, it could be cancer, it could grow anytime, I don't need surgery. And they'll seek natural routes or, do an internet search for what are the natural approaches or lifestyle habits that could optimize or help shrink their fibroid. So is that valid? Is there any science behind it? Any insights there?
Yeah, there's really no science behind a lot of this stuff. Putting castor oil on your abdomen is not going to take away your fibroid. I'm probably going to get a lot of backlash for saying that. But, there's all these hacks on TikTok, right? About put castor hacks and all these things. Maybe it's going to help you. Maybe it's going to make you feel better, but this is not going to shrink your fibroid. And so, one of the things that we do know, there's two links in terms of diet that can help. One is eating a lot of cruciferous vegetables. So cauliflower, broccoli, these kinds of veggies there has been a link to decreasing fibroid size. And the other is vitamin D supplementation and making sure you have enough vitamin D. So these are two links that we've seen in recent studies. So if anything, if you're going to do anything more natural, these are the two things that I suggest to patients. But if rubbing castor oil on your abdomen or taking some pill or some herb took away our fibroids, well, we wouldn't have a fibroid, pandemic in
Yes.
right. So if it were only that easy, but it's not. I wish it were. I wish there was something more natural we can do. But I think just like in your field, I think trying to eat more healthy, sleep, move, and kind of maintain a anti-inflammatory lifestyle, so to speak, benefits us and benefits even fibroid growth. So I think that's what I really talk to patients about.
See, that was very, very, very well put together. So I had a discussion with a rheumatologist last week, and we talked about gout and uric acid. And literally, there are such commonalities between certain foods that are a no-no. So I think you mentioned about during a rapid fire about maybe some link about red meat worsening it or having a negative impact on fibroids and the benefits of certain types of vegetables and vitamin D supplementation. Those same discussions were also similar for, prevention of gout and that anti-inflammatory diet. But still, we need to get the right expertise, right knowledge. And like you mentioned about that annual screening with the clinical exam is so, so very important. And this was really shocking, though. In summary, if you had to give or bring about some alleviation with the anxiety of I have tumors in my fibroid or I have tumors outside the fibroid. First few steps that a woman should be doing doesn't matter what the age is, but once they discover what are the certain steps that they can pursue or resources that they can seek to get the right care.
Yes, that's a really good question. So the first thing I would say is not to panic. Many women panic when they find out they have a fibroid and it's a tumor. Most fibroids are benign. And I really want to stress that most fibroids are benign. I have seen some malignant ones, maybe three in my entire career. And I've seen, hundreds and hundreds of patients with fibroids. And so don't panic. The second is to see a gynecologist. And there's a lot of people out there, who are practicing gynecology who are not really board certified gynecologists. And so I would really emphasize seeking out a board certified gynecologist who can, examine you every single year. We should all be getting that exam anyway as part of our screening. And that way, if there are fibroids, they can adequately guide you. And the third is if you're really trying to figure out, what you should do, surgery versus no surgery, monitoring, versus some other non invasive surgery versus hormone treatment, it's best to see somebody who really specializes in this because those of us who take care of women with fibroids, we really spend a lot of extra time training around this and learning the nuances of the surgical techniques as well as the medical management of fibroids. And so seeking that kind of physician is really important. So having this kind of well-rounded team is very helpful because maybe you're not going to do something about it this year, but maybe in 5 years you want to get pregnant, or maybe in 10 years, they actually cause symptoms. You want to have your team because, as we all know, finding a good doctor, good surgeon is sometimes hard and not timely when you actually need it. So, having that team and making sure you're seeing them on a regular basis is what I would recommend.
So true. That trust becomes so important because one meeting may not just build that in terms of, okay, I am surrendering, go get the surgery, whatever. I'm in your hands. Yeah, so well said. Thank you so much. If our audience or if anyone who's listening to this insightful discussion, if they had to learn more from you about fibroids, can you share or how could they reach you?
Yes. So I have a social media channel, YouTube, TikTok, and Instagram. It's called The Fibroid Doc. And so I have lots of videos and resources. I have a website called thefibroiddoc.com. So you can check out those resources for a free fibroid guide and really all your fibroid questions answered. And then if you're in California, I have a private practice in the Lamorinda area in Lafayette in the Bay Area. So you can definitely find me here for a consult. If you're anywhere else in California, you can certainly do a virtual consult with me. And if you're somebody with fibroids and you're trying to figure out what's next, what should I do, and you want to talk through it and you are not in California or you are elsewhere in the world, you can certainly email our office and set up a fibroid coaching call and we can still talk about all of these important topics.
How impressive is that? All the resources under one umbrella. Everything about fibroids. Thank you so much, Dr. Prabhakar. It's been a privilege.
Yes, thank you so much for having me. This was so much fun. Thank
It
you.
was. Thank you.